Abigail had always been a superstitious person. As a child, she would avoid stepping on cracks in the pavement and refused to walk under ladders. But as she got older, her fear of the number 13 became an all-consuming phobia. Triskaidekaphobia, as it is known, had taken over her life. For Abigail, the number 13 brought with it a sense of dread and unease. She would refuse to attend events or meetings that fell on the 13th day of the month, and would often become visibly anxious when the number appeared in any other context. It was a fear that she could not explain, but one that controlled her life nonetheless. Abigail's Triskaidekaphobia began when she was just a teenager. She was staying at a friend's house for the weekend, and they decided to watch a horror movie together. The movie featured a cursed house on the 13th floor of an apartment building. As the movie progressed, the number 13 became a recurring motif. Abigail became increasingly uncomfortable, and by the end of the movie, she was in a state of full-blown panic. After that experience, Abigail became obsessed with the number 13. She would avoid it at all costs, and even went as far as to change her phone number and address to avoid having the number in her life. But no matter how hard she tried, the fear would not go away. Abigail's Triskaidekaphobia had a significant impact on her life. She struggled to maintain relationships and would often cancel plans at the last minute if they involved the number 13. She found it difficult to hold down a job as many businesses used the number in some way, whether it was on a form or in an email address. Despite her struggles, Abigail did not seek help for her phobia until much later in life. She had always believed that her fear was irrational and that she should be able to overcome it on her own. But as the years went by, her phobia only became worse. It wasn't until Abigail met a therapist named Dr. Jones that she finally found the courage to face her fear. Dr. Jones was a specialist in treating anxiety disorders and had helped many patients overcome their phobias. He encouraged Abigail to confront her fear of the number 13 head-on. The treatment involved a process called exposure therapy. Over several weeks, Dr. Jones gradually exposed Abigail to the number 13 in a controlled environment. At first, they simply discussed the number, then moved on to looking at it on a piece of paper. Eventually, they worked up to having Abigail say the number out loud and even write it down. The exposure therapy was challenging for Abigail, but she persevered. With each session, she became more comfortable with the number 13. She began to see it as just another number rather than a harbinger of doom. The treatment also involved cognitive behavioral therapy, which helped Abigail to reframe her thoughts about the number 13. Dr. Jones helped her to recognize that her fear was based on irrational beliefs and that the number itself held no power over her. As Abigail progressed through her therapy, she began to feel a sense of freedom that she had not experienced in years. She was able to attend events and meetings on the 13th day of the month without feeling anxious. She even began to see the number 13 as lucky rather than unlucky. The change in Abigail was profound. She no longer felt held back by her phobia and was able to live her life more fully. She was able to take risks and pursue her goals without fear of the number 13 holding her back.